What are some of the advances in dentistry in the last several years?
Well, thanks for asking. I think one of the main things that we need to focus on is dental implants are really changing the way that we restore teeth in ways we haven't been able to before.
So dental implants. Now, what is a dental implant?
Well, a dental implant is a piece of titanium, kind of like the rods and pins that are placed in other parts of the body. This piece of titanium, usually in dental instances, is like a screw, and we can actually put it into a jawbone, whether it be the upper jaw or lower jaw.
So it's a titanium screw. You can put either in the upper or the lower. How big is it?
Well,
Can't be that big.
yeah, no, they're small.
Half
Typically,
inch, somewhere
we usually do millimeters in dentistry. So usually somewhere around 10 millimeters long and anywhere between 3 to 6 in width. So that's our typical size.
Good. Is it hard to screw in?
Well, no, it's not hard to screw in. Typically the surgeon that's placing the dental implant makes a pilot drill, just kind of like you were hanging a picture on the wall. We make a pilot drill and then we make it larger and larger until we have the size implant that we need, and we can just screw it right in.
So you put a little hole, a bigger hole, and a bigger hole on top of that till it can receive the screw.
Precisely.
The titanium screw.
Yes, sir.
Now, you got a screw down there. Where's the tooth come in?
Well, that's a good question. We can't always just put a tooth on top of that screw once we put it in the jaw. Sometimes we need it to heal. That healing time can take between 4 to 6 months, and at that point, it's healed and it's really a part of the bone at that point. We can put a tooth or a denture or all kinds of different things. They're really dynamic.
So if you've got a screw in the lower jaw, we'll say for instance, and you've got to let the bone hook onto that titanium screw, do you have a vacant place there? Or you put an artificial tooth while you're waiting for it to hook onto the bone?
Well, every case is a little different. Sometimes somebody doesn't have any teeth at all, and at that point we don't have to worry about preserving the space where that tooth was. We just let it rest until we can use it maybe to hook it on a denture.
Let's say I played football and I got my front 4 teeth just knocked out, and I've got in a prosthesis in there, and I've got 4 teeth there, but I'm sick and tired of taking them out, and I want some dental implants. Am I a candidate?
Absolutely, you're a candidate. There are not a whole lot of contraindications to implants, so almost everybody can have them, but it's really important that we have a good medical history and also dental history before we do them. But yes, exactly, we can replace 1 tooth at a time, 2 teeth, 3 teeth, and restore those teeth that you were talking about.
If I had 4 teeth knocked out, what do you have to do about figuring out how far apart it is and what you're going to put? Every case should be an individual. How do you individualize the cases?
That's a great question. Well, what we do is first you'll see a restorative dentist, somebody that's going to put teeth on top of those implants, and they'll sort of be the ones that quarterback planning where the implants are going to go and make sure that they're the right amount of space between each other and between the adjacent teeth that you already had, and really making sure that it's planned well so we can put a tooth on top of it that looks natural.
I haven't thought about that. You just can't put 4 teeth in. Do you put them all together? Are they all lined up together? You put 1, 2, 3, 4 in.
Well, they have to be very precisely placed so they don't look like they're coming out like buck teeth. We don't want that, or coming in a way that maybe you couldn't chew with them very well. So we need to carefully plan that they're parallel to each other and that we can have really nice restorations that way.